Perfect. Good afternoon, good morning, good evening, everyone, whichever part of the world you are. Thank you so much for joining our podcast today. I have Mr. Abrar Ahmed Syed today joining us. Abrar is an experienced analytics professional with over 15 years of expertise in data visualization, business intelligence, server deployments, and analytics solutions. He serves currently as an advisor application designer at Gainmail Technologies, a leading data and analytics organization that enables businesses to leverage data driven insights for transformation and growth. Abrar is passionate about creating impactful and engaging analytics narratives. Abrar focuses on empowering decision makers with actionable intelligence to drive positive outcomes. As a Tableau certified professional, he possesses extensive expertise in Tableau and other BI tools, designing and delivering customized analytics solutions across diverse industries and sectors. Abrar, thank you so much for joining us on the podcast today. And today we'll be talking and discussing with you about governed self-service analytics in healthcare. It's a new topic. Before we jump into the topic, I'd like to let you speak a little bit more about your experience, your expertise. What exactly do you work on? And then let's jump into the topic.
Yeah, thank you so much for inviting me. It's great to have you here, be here and talk about analytics and healthcare. Right. So I'm Abrar. I've been in IT for more than 15 years and 10 years in healthcare, 10 plus years
Mhm.
in healthcare. At my current role, I manage the analytics platform across multi-cloud infrastructure. We have different analytics solutions that we implement in our org, um, from Tableau to Power BI to MicroStrategy to BAO. We have different solutions. I manage the platform side of it. I also have developed the architecture side of it and framework for self-service analytics. Um, we we have evolved as a analytics platform team from for the last 10 years, from going from basic analytics SDLC cycle to enabling self-service analytics, now predictive analytics, and the advanced analytics, enabling the users and even the external users like state gov clients with capabilities to do analytics on their own. So I manage the team. I have uh, several people that work for me in the team, um, both on site and offshore. And we have several states that we support analytics, and and everyone loves self-service analytics, and they like being empowered. I mean, they come from Excel background, and they come from
Mhm.
the very practical workflow kind of approach. So they'll really like. I'm going to talk about more as we go on.
Absolutely.
Thank you for inviting me.
Sure, sure, bro. Thank you so much for giving that narration. So let's delve into the subject. The topic of today's podcast is governed self-service analytics in healthcare. Honestly, I've been in technology, I've been in healthcare IT, most on digital transformation, specifically addressing the healthcare clients. More of my focus has been on the data side and the analytics side. So whenever these two terms come together, what we think about is the data utilization, how the data is being analyzed. Specifically, of late, I have also written one of the papers recently where we talked about real-time decision making in healthcare, where data is constantly being used, and now because of the AI tools, we constantly have the on the fly real time data analysis and that feed going into physicians, nurses, even the healthcare administrators who manage all the healthcare day to day operations, clinical as well as non clinical. And one of the major important things which we think about analytics, use of analytics and utilization of vast amount of data in healthcare is related to diagnosis, the disease diagnosis, which is becoming really the key right now because, as I say, AI is delving into digital transformation. That's where, like, the tangible applications of healthcare we are looking in, how the patients and the care providers are gaining into it. But whenever I talk about analytics, my basis of my understanding, it limits to just the data and the analysis of the same, and how that data is being deciphered, how it's being utilized, how it's being fed into the system to help and aid the decision makers to utilize their data. But when we talk about self-service analytics, so that is something kind of a new terminology, at least for me, and I'm sure for some of my audience also. This will be something new. So tell us from your experience. You are an expert here. So
Yeah.
when we talk about self-service analytics, so what is it and why is it important in healthcare?
Yeah, before AI came into picture, right?
Mhm.
You are spot on with your insights onto that topic. Before AI came into picture, there was something called BI, right?
Okay. Yep.
Business intelligence was huge, right? And
Mhm.
tools like Tableau, MicroStrategy, Power BI came into picture and changed the space. How easy was it to build those analytic solutions, right?
Absolutely.
Coming to healthcare, it's like data and healthcare is a beautiful relationship, right?
and
Healthcare
a
is
com-
rich.
and a complex too, because we
Yeah,
talk
yeah,
about personal healthcare and health information here. Yeah.
yeah, and rich with data.
Mhm.
Lot of data, a lot of different varieties of data, a lot of
True.
different sources of data, and different type of data also, right?
Mhm.
Different format. Like some of the data is in the documentation, like paper documentation. Some of them is from the images, some of them come from IoT devices, some of them is like just voice notes of the doctors and nurses and whatnot, right? So
Mhm.
um, data in healthcare plays a very very important role, and you being at the very front end of the data, you know how challenging it is, right, to
Absolutely.
get the data into a system where we can do analytics on top of it. From going from SDLC cycle where, oh, I need a dashboard, right? Then you'll be like, okay, give me the requirements, then requirement analysis, then start development, and then go from UAT phase to production phase, and then, okay, user, here is your data, right? I mean, it
Mhm.
takes ink to green. Is a lot of time, and healthcare require quick analytics, quick insights into the data, rather than waiting for months for it to go through the different cycles,
Mhm.
right? So that's where self-service comes into picture, right? It plays a key role in the non-technical users like
Okay.
nurses, doctors, and admins to just build a dashboard, pull the data,
Mhm.
just add it as a source and multiple sources, and just see what's going on with that data, right?
Kind of a
So
hands-on, like they don't need to know the technology
yeah,
behind, they don't have to do the coding. They can
yeah,
just, like, it's as good as like probably like similar to maybe to a Google site preparation. We just pull in the boxes here and there to create a
yeah,
site. So similarly, like if you're saying, we created the nurses, the doctors who are not that tech savvy, at least in the back end systems, they can just pull the screens and create a dashboard on their own.
yeah. It's like plug and play, right?
Okay. Oh yeah,
uh,
wonderful. Absolutely.
yeah,
Yep.
and
For that
in
word.
here it's just like drag and drop,
Mhm.
drag
Okay. Okay.
the different widgets onto the screen, apply the
Got it.
data, and it'll give you the insights, right?
Got it.
So self-service plays a key role, right?
Mhm.
And everyone wants to be empowered. No, I mean, waiting for something to happen and getting the results after a while is like, the data is evolving by the day, and you don't have to wait till you know what's going on with the data, right? And
Mhm.
it keeps changing the shape, right now.
Absolutely.
The
It's
the
dynamic. Yep.
Yeah, it's dynamic, and it differs by geography and whatnot, right? One thing that you build a solution on analytics, you cannot apply the same thing elsewhere, right?
Mhm.
So for us to build the analytics at the source itself, and give the solution right at the beginning, right at the systems like providers and admin hospitals and whatnot, right? It plays a key role, um, and that's where we come into picture, and we have designed multiple self-service analytic solutions for gov clients. Mainly, Gainwell focuses on the state gov clients, and we provide analytic solutions for them, and I manage the platform side
Wonderful.
of it.
I was thinking, like, probably from our side, we who are doing the transition, the transformation of legacy system, we are more important. But now I realize your role is probably even more important, because you are empowering the end care providers who can really use the technology in much easier way. So probably I might feel threatened by your job right now.
Yeah, I mean, with the advent of
Mhm.
AI, ML, right, and um, uh, I mean, which is really good, right, and there's a lot more to evolve, right,
I'll have specific
and
questions on AI for you. So let's hold on to those thoughts right now.
sure,
But thank you
sure,
so much for explaining in a very simple way how self-service in analytics works, and specifically in healthcare sector. So when and you rightly mentioned, you empower these care providers, but when we talk about empowering, the actual data is of the patients, the whose data is being utilized by these care providers, the payers, the providers, the hospitals, the physicians, etc., the nurses who use their data, and it's their personal data. And recently, I was talking about the DIDs and the blockchain. I presented in one of the conferences as well. We talk about empowering the patients, the end users, who they can make or probably enable the access to their data at what specific time, in what specific situation, and what specific end network, where and how they can utilize the data. So when we talk about that here, in specifically when you talk about self-service analytics, we talk about, I think so, access control is one of the key measures. And then when we are talking about PHIs and PAIs and healthcare, I'm sure the compliance, the HIPAA guidelines, the GDPR in Europe, and other state-specific healthcare laws for data and privacy protection for the healthcare data, that surely holds true. Because when we talk about and think about governance basically think like, okay, there is a governance team who will look into it. They will be having some foresight.
yeah,
But here we are talking about self-service analytics. So from your
yeah.
perspective, how and why is governance so essential when we are talking about self-service analytics? And I'm again talking about the scenarios in healthcare sector only. So what are your thoughts on that?
Yeah, so governance is
Mhm.
key, right? So based on right, the penalties of the data violations are
Mhm.
huge on in healthcare. Making sure right data is accessed by right
Mhm.
folks is very important, right? So the governance plays a key role, right? Access controls that you talk about, um, uh, m- building something called data catalogs and data literacy, where you can actually give access to the folks, right folks, with the right data so that they can do the analytics is very
Mhm.
important, right? One such
Okay, yeah,
example,
you're
right,
showing
that you
something on the screen
have on
here.
your screen.
Yep, just
Yeah.
explain this to us, please.
So let's walk through
Mhm.
an example, right? Okay, so someone wants to do an ad hoc analysis, and let's see how the journey
Okay.
goes on, right? And a requester, it can be a, a, the manager or a provider, right, wants a dashboard to
Mhm.
be built, right? And when it comes to the content creator here is the actual nurse or the admin, or uh, admin desk
Okay.
official that is looking at the data, right? And what they do is, like, they have the set of spreadsheets or their set of data that they already
Mhm.
have, which they gathered through their patient workflows. They connect to the dashboard, they build the dashboard, and they and just once the dashboard is built, they go back to the original creator and say, okay, is this something that you want, right? And then the person that who requested the data, they looks at the data and says, okay, no, yeah, I think this is what I want, and this is just like temporary, right? The analysis that the person did is very temporary, and then after a while it may not be
Mhm.
relevant, right? So but enabling these individuals and the personnel at the forefront of the healthcare systems is very
Mhm.
important. That's where our team comes into picture with enable having the governance around this platform, making sure they have access to the right
Mhm.
data, and making sure data is secure in the system. It's compliant with HIPAA and
Correct.
GDPR and CMS, Medicare, Medicaid
Yeah.
policies. That those access controls and guardrails that we put in are
Mhm.
very important. Just having an open access to a platform is really good, but it can lead to um, getting the data out of the system
Okay.
and exporting to some other places which we do not have control or we
Got
cannot
it.
manage, right? So having governance is very
Okay,
key.
wonderful. So there is another picture I guess you wanted to show us about.
Yeah.
Uh, So is that about, just a second. I think that's one another example which you wanted to show us about something on self-service.
Yeah, the self-service, right? How the process
Mhm.
works, right? How we put those guardrails, and uh, we need to have a workflow or a system for managing these self-service analytics, right? um, Putting restrictions on data, putting access controls, and dividing the data into data sets and data catalogs, and having a data literacy documentation is good, but having a workflow will
Mhm.
help, and having the key personals and defining roles for each of these individuals is really key,
Got it.
right? So a requester comes in and says, oh, I need a dashboard, right? And then the nurse or uh, the the health admin professional goes in and pulls up the
Mhm.
dashboard and connects to the data source. It can be any data source, it can come from a different variety of sources, builds a dashboard and say, okay, I want to review it with the requester, right? It can be a provider or a um, uh, or a
Yeah, healthcare
admin
administrator. Yeah.
manager, or right. Yeah. So I think once the dashboard is created, right, it goes through different
Mhm.
processes before it actually is available for other users to consume, right? So what we do is we have a roles, we have set up roles for approver and also the site
Okay.
admin and the content creator. The content creator is the person who is building those
Mhm.
dashboards and who's developing the dashboards on its own, right? And he is a non-technical
Okay.
user and sitting in front of, and the role varies from as simple as a nurse to a BA, right? It can be anybody doing between that roles, right? And once that dashboard is built in the sandbox space, it goes through a process where someone has to approve it, and it will be a person who knows the in and out of
Mhm.
the system, like business approver, who approves that okay, this dashboard is built as per the needs, and certifies the content and says okay, this is good, and then it comes to us where we take those dashboards and certify them into the production environment and make it available for the enterprise audience, right? The whole process is the certification process. Even though we enable the self-service
Mhm.
analytics, it has to go through different stages of self-service analytics before it is made enterprise um, um, ready.
Okay. Okay. No, makes sense. These workflows are really helpful. I'm sure made the understanding a little bit much easier for us to grasp this very technical, in-depth analysis which you provided. So when I yeah, you stop sharing. So when we talk about the certification process, I'll just pick up some of the keywords which you responded in your while you were explaining the
Yeah,
workflows. You talked about certification process. Uh, so in that situation, then we are looking at something like standardization of the processes.
yeah,
Then when you
yeah,
also talked about access-based control, then you also talked about setting up and providing access, then the request going to nurses, and also there are like lots of technical terminologies, technical handshakes happening between different players on that workflow. That means there is a very key requirement for training for all the resources or probably all the users across these workflows as well. What I see from
yeah.
my perspective, from the business perspective, and from the end user perspective, isn't these lots of challenges when we talk about implementing a self-service analytics? So I'm sure like not everything is hunky-dory. There should be some issues, some gaps. Even when we are talking about the most advanced smart technologies, the AI's applications, and the AI tools which we are leveraging, we always face challenges some way or the other. So, from your perspective,
Yeah.
what you think are the biggest challenges when we are looking at implementing these self-service analytics in healthcare?
Yeah, we at the beginning of this session, right, we talked about how rich the
Mm,
healthcare data is, and it comes from different sources and different
true.
variety of data. So having a data literacy
Yep.
is key. Setting up a data catalog and dividing the data into different segments like eligibility,
Mhm.
claims, payment, um, diagnosis is really important for us to make sure data is categorized in a proper way and access controls are put in a way that um, the the person who needs those
Mhm.
data can go directly to those sections of data literacy, and data democratization, that's what we call it, right?
Yep.
Making, training the professionals with the data, and helping them understand the standards of the data and how it has to be set up, and adding those feedbacks into the ETL pipelines so that data is
Mhm.
cleansed and ready for analytics. Right? Even though you have capabilities to integrate the data on the fly in these analytics platforms, having a precursor where you cleanse the data and massage it
Mhm.
beforehand helps a lot. You don't have to worry about the quality of the data, or you don't have to worry about the trust on the data. You already know that okay, this has gone through a cycle of cleansing and
Mhm.
transforming, and it makes it easy for the person, the analyst, to trust the data and move quickly to analytics, right? um, so I think data, understanding the data is really key. Even though you put guardrails
Mhm.
around it, right? And with healthcare data, it's complex. It's huge. Sometimes if you're dealing with member data and claims
Mhm.
data, it's a
I
lot
know.
of
Yep.
data, um,
Mhm.
and doing analytics on the fly might be
Mhm.
challenging. So having these segments where you actually get the data and you can funnel the data that you don't need and you only focus on the data that you need really
No,
helps.
absolutely. And specifically when you talk about, you mentioned about CMS and the guidelines specifically for Medicare and Medicaid. Most of these payer organizations for enrollment and even for claims processing, they still use the paper trail. We have lots of
Yeah,
providers still filing paper claims. We have lots of our senior citizens, even the Medicaid members who don't have access to net and access to the internet, they still do the paper enrollment processing. In that situation, the
yeah,
quality of the data which we get, we just cannot really use the data as it is, like just convert and scan the data and get the data that you rightly mentioned. The data has to be analyzed, it has to go through the quality process, it has to be cleansed. Even in claims we have data scrubbing process as well, that we have to really do the validation of what the information is being put, compare it against the ICD codes, and do a validation of the data before it gets feeded in the system. And then the system does the auto adjudication of the claims and processes the data to give the outcomes, and then the payments etc happen. So those are very important things.
yeah,
So when you talk about all these things, and then you made a very important key point about data literacy as well. So are we, do we, like whenever we do an implementation in specifically in a healthcare organization, that okay, the healthcare organization, like we have our set role players, right from the doctors, physicians, nurses, healthcare administration, front office staff, even the healthcare management, the back of that, the back administrative staff as well, who are managing the entire end-to-end payer operations, or end-to-end even the clinical operations of the tools and the technologies which we are being using on a healthcare platform. Do we define from the self-service analytics perspective, do we define any specific best practices which needs to be adopted, which are like you laid down, okay, these are the key terms which are laid down in stone, which has to be adhered to before we can get ahead and get started even thinking about implementing any self-service analytics platform in our healthcare system? So from your perspective, what do you think these are the key elements or the best practices which should be focused upon?
yeah. I think it's like 50
Okay.
50, right? The more restrictions you put, it gets harder for people to do self-service
Okay.
analytics, and you cannot even leave off the hook and say, oh, you can get
Yeah, you're
whole
talking about
data and
healthcare.
do
Yep,
your own,
absolutely.
right?
Mhm.
Yeah. So I think, for ad hoc analysis, right, they are free to do
Mhm.
whatever they want, right, and they can embed the sources and pull up the data and drag and drop those widgets and build the
Mhm.
dashboards. There's no restriction on that, and um, uh, uh, apart from the data literacy itself and data cataloging and having access controls on this data, who can get what access, there's no restriction on the self-service ad hoc analysis. But when it comes to certification and when it comes to making it
Hmm.
enterprise-wide and making it
Okay.
standard, that's when the standards come into picture. Okay, so you cannot, the response time on these dashboards cannot be like, oh, it loads, it just spins for 2 minutes and loads the
Hmm.
data, and uh, and there's a lot of, we want to make sure the UI is good. We want to make sure data is accurate. We want to make sure data is
Hmm.
scalable. It works for a small set of data, but it doesn't work for a large set of data. So all those kind of different challenges of um, uh, transforming from self-service analytics to enterprise analytics come into picture. So that's when we come into picture, and we create those governance and processes, so that we help them go through that certification process through um, uh, through it through different guardrails, and make sure it passes those certification criteria before it goes and sits in the enterprise production
Okay.
environment, right? um, yeah, so I think mainly the education is important. The training the data
Hmm.
and also the education of the data is key. And and we should uh, given where we are at this stage, right, of technology, with new technologies coming to picture, right, the putting restrictions on self-service analytics is going to
Hmm.
slow down and push away people from doing analytics on their own, and they're going to rely on more on this ask the question, get the answer kind of NLP, natural language
Hmm.
processing kind of tools, where which sometimes doesn't fit into the healthcare because of the sensitive nature of the
Absolutely.
data and whatnot, right? So um uh, from my thought process is that, like, whenever the front end clinical analysts are doing any self-service analytics, we give them full um, uh, power and of doing analytics on their own, and give them capabilities and give them
Hmm.
training, and also reward them with a analytics
Okay.
champion kind of certificate. So we had this program that where we went from like 6 developers to
Oh,
140
wonderful.
developers,
Mhm.
right? We were like, for the BI team on our in Gainwell was like 66
Mhm.
developers, right? And it's a bottleneck, and we used to get so many requests to build
Okay.
dashboards, and I thought this is not going to work, right? And so we came up with a self-service analytics platform where we got obviously more licenses, and then we started training the
Mhm.
data. We from every LOB, we made a business
Okay.
champion and say, okay, he is the point of contact before you reach out to us, right? There's another level of business
Mhm.
champion, analytics champion, that you can reach out to, and he has different analysts that work under him. So building that kind of a uh, analytics
Relationship, you can say. Yeah.
center of
Uh-huh.
excellence
Okay.
was key, from going from like 6 developers to like more like 140 plus
Okay.
developers right now. And it keeps on growing, right? So, and it from our role, right, uh, our role was more restricted to managing the platform and setting up the
Mhm.
governance, and making sure we get the data in a timely
Mhm.
manner to these analysts, and they can uh, they should be always ready to do analytics whenever they need to, right? So empowering them was
Okay.
the key.
From your perspective, who are the more troublemakers? The caregivers, the healthcare administrators, or the healthcare management staff? Who trouble the backend support system team members more? Who are the more tech savvy, if I have to
um,
put it positively?
yeah, I think with the data, right, there's always compliance
Um,
is key, right? And some of the analysts wants data access, but we cannot give them
True, true,
access
true, true.
because of the PHI and
Yep, yep, yep.
PI, and the different compliance, regulatory compliance. And you also know that, right? The penalties are
So who has the
huge.
access control? If
The
I may ask, who has the overall? key, the master key to the to access the PHI? Is it the analytics team who hold the key?
It's a
Data
data
engineering.
engineering
Okay,
team,
okay. I was wondering. Yep.
right?
Okay.
So, and we define, we help them build
Mhm.
this data architecture, where we help them define different data catalogs and divide the data into
Got it.
subjects,
And
different
then are there like
subject
frequent
areas.
data audits as well to ensure
Yeah,
compliance?
audit. I mean, it's
Okay,
ongoing,
okay.
right? Every time there's an audit, and for us, like there's internal audit and there's an
Hmm.
external audit. The internal audit is like every week.
Okay,
There's an audit
got it.
on who has access the data, what level of
Hmm.
data, and what was the queries. Even you cannot query the data
Okay,
directly. Uh,
makes sense.
as well, there's a lot of systems in place where they can easily find out if you go into a very detailed single
Hmm.
row kind of a querying, it'll flag the system and alert the uh, compliance team saying that someone was trying to go into that level of data, right? So um, um, those are the things are very
I understand.
challenging, like
In fact, when
with
you
the
mention
data, right?
about that is the data engineers or the owners of the providing the access, they are not even uh, have the probably the, you can say, the permissions to run the data query on the actual data because it involves PHI. In fact, in one of my presentations on ethical AI, I had talked about the subject of federated learning. What we do is, instead of using the actual PHI or the actual real data, real PHI data, we make a copy of that, a dummy copy, which
Yeah,
replicates the non-essential PII information, but the rather than not non-essential PII information, and the PII information is just kept. So, for example, like I have some kind of a healthcare historic data about my, let's say, my health, my heart issues, or any of the other issues.
yeah,
So they will utilize the medical terminologies, they'll utilize the medical codes, the diagnosis codes, etc., and replicate into the federated learning data feed.
yeah,
But my name, my date of birth, my address, my information, which can
yeah,
actually correlate that this person is the is the patient and this is his or her data, that correlation is kind of blurred or encrypted, so that even if the data
yeah,
is unfortunate, like by cyber threats or through that it's hacked, that access to the actual data is, it does not fall into the wrong hands. Even if the outcome falls
yeah,
into the hands, the personal is not being able to identify, so at least the identity is protected in case of a breach. So that's one of the key aspects which I learned about when I was
yeah,
thinking about ethical AI and federal. So that being said, Abrar, my thank you so much again for explaining all these terminologies. Like, I learned quite a few things. For me, analytics was just related to data analytics. I didn't even have much understanding about the self-service enablement of data analytics, and as well as then having a governance on top of that to provide access, to enable standardization, even like to a process where we kind of have a dragged off facility for the clinicians and the healthcare administrations and the management. So my last and my favorite question is, uh, given all these terminologies, and we also touched upon artificial intelligence, and when we talk about artificial
yeah,
intelligence and then we delve into data and analytics, one of the very interesting topic which comes is the predictive analytics we talk about often.
yeah.
You talked about compliance, everything. Put all this together, what do you think the future of self-service analytics in healthcare holds for us? What do you foresee about this particular, your topic of interest in future, 5 years, 10 years down the line?
Yeah, so with AI, right? AI and ML coming to
Mhm.
picture, right? And we always so the, I there are two key items, right, when you're dealing with data. One is speed and
Okay, yep.
accuracy, right? And with quantum computing and cloud computing and AI and ML coming to picture, the processing of data at a
Mhm.
fastest rate is already
True,
improved
true.
and already being used across multiple systems and multiple technologies and
Mhm.
industries, right? So that is solved. Now the accuracy, right? So maintaining an accuracy is key. For that, right, we need systems where we can process the
Mhm.
data from different sources and have the data available right? Integrating the data from live home care systems, like there's the patient's home care data, and IoT devices, and like Apple watches, like different source of data, getting the data from
Hmm.
different sources and integrating them into a
Hmm.
system, and massaging the data and making it more um, accurate and in a proper format, um, is already helping self-service
Okay.
analytics. That's where the self-service analytics comes into picture. Once you have the data at a speed and it's accurate and it's in a proper format and from different sources, 90% of the
Mhm.
job is already done, right? And then the analytics, that who wants an ad hoc analysis, ad hoc dashboard, they could just come into picture, the drag and drop, and then build a dashboard on their own, and without relying on an IT tech professionals, right? So building that, the whole front end of it, right, the main data, and curating the data in a sense that is usable, which AI is already
Okay.
helping with, um, will only enhance self-service analytics. It's always
Absolutely.
there. We used to think like, okay, with BI, oh, BI is gone, and then now it's
Mhm.
AI, right? And BI is always here, but it's only enhances BI
True.
more with
True. True.
AI, right? It helps BI a lot more, and BI is still going to be there. It's still the key for generating analytics, right? Um, but AI is only making it much more powerful. Um, so it's, and with healthcare data, it's even more important for us to use these technologies to good effect, to enable with more powerful self-service
Absolutely.
analytics.
Thank you so much, Abrar. Those are wonderful thoughts, and I'm sure maybe in future we might see even AI tools being utilized where you don't even have to do the drag and drop. You just click a button, and the AI is going to create a dashboard on your own for you yourself with its
Yeah,
set defined
yeah,
templates and its themes available already on the fly. So, but thanks for
yeah.
sharing your thoughts. I learned quite a lot about self-service analytics, which was kind of a new subject for me, and also for sharing your thoughts about how we address the challenges, how we create best practices, standardization. Those two workflows were really helpful for us to understand how the handhold happens, how the data transfer happens, and the access controls are provided. And then your wonderful thoughts on the future of self-service analytics. Abrar, thank you so much. Any parting thoughts for
Thank
us before you wind up?
No, I think this is great. Thank you for the opportunity to talk about my
Likewise.
favorite topic, right, self-service
Yeah.
analytics.
All right. Thank you, Abrar, and thank you to all our audience. We'll talk again later. Thank you. Bye. Take care.
Yeah.